What's going on, everyone? Happy Monday. Happy President's Day to everyone in the United States. Hopefully everyone is doing well, staying safe, healthy, and having a great day so far. If you had to take a COVID test, flu test, or a test for one of the other viruses, I hope you have tested negative. If you did test positive for any of the viruses, I hope you have a full and speedy recovery with no long-term and no long COVID issues. It is time now for the Monday, President's Day edition of the Virus Update for Monday, February 17th, 2025. If you're new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. Let's face it, there's a lot of viruses out there, and you need a news report type program that keeps you informed of what's going on with these viruses each and every day. That's what I do here on my channel. I'll give you the latest news, data. If I see a new study come out, we talk about that as well. So if you want to stay informed with what's going on, just subscribe down below. Give this video a thumbs up. Hit that notification bell. And of course, share this video with anyone you know. Alrighty, today is a holiday, so some things did not update today, but we do have a good amount of news to talk about today. We are going to do some daily things, such as what's going on with EMS call volumes and the places we check for that. And Walgreens did update today, so we'll have some new Walgreens numbers. And plus, we're going to take a look at wastewater and some hospital capacity data, if there's enough time to fit all that in. Definitely going to do some wastewater. There's a few places we did not do yesterday, which I promised I would include. I said, and so in the comments, I got some comments saying, can I do here and there? So if I remember those places, I will get to them today. I think it's Oregon and Colorado that I want to focus on when we get to that. Alrighty. First off, I have to tell you I had my doctor's appointment today. And remember I had COVID a month ago? And I was having a headache issue? Well, I told him about that. And right off the bat, he knew that I was sick. I don't know if he follows us here on our channel or X or anything. Right off the bat, he knew. So I guess it probably showed up in my record that I went to his physician's assistant and that I went to urgent care the next day. And I told him that I was treated as if I had pneumonia. I told him the whole story. I'm not going to repeat the whole story now. But the point is, he took me seriously with COVID, saying, yeah, all your problems that you're continuing to have definitely could be COVID. And what's going to happen now is I'm going to be on this steroid for the headaches for 1 week. If that steroid does not work, I am to call him back and I'm going to go get an MRI done. And we're going to do like a wellness check in a week. So we'll see what happens. Hopefully this steroid works. And I've already sent over the request to get the MRI. The doctor's office did that. Already been approved by insurance. So if need be, a week from now, an MRI could be in the cards for that issue. Alrighty, getting into today's update. We have a lot of things to get through. Weekly U.S. COVID update from BNO News. New cases, 168,329. Admissions, 11,783. That's down by 4%. In the hospital, 9,829. That's down by 5%. In the ICU, 1,366. That is down by 11%. New deaths, 966. And the average actually did go up by 2%. More than 1.3 million COVID cases have been reported in the U.S. so far this year, causing 95,923 hospitalizations and 6,109 deaths. Though some say it's not a big deal, COVID, flu, all the viruses this winter combined together have been a big deal. Although COVID, not as bad as other years. Hey, it's still a thing. Flu, worst we've seen for flu in probably since 2009, if not beyond that. Now, we might even be beyond 2009. I saw some estimates saying maybe the early 2000s. Second child flu death now reported in Tennessee. So this is not good. We're seeing, we're seeing more news stories this year, more data coming from public health departments in different states saying, hey, a child has died of flu. We just saw San Diego the other day. We're seeing a lot of different states talk about this. Flu is hitting people hard at all ages this year. Not just the older population, the younger as well. And you have to remember, there's a lot of studies out there that suggest if you had COVID, your immune system could potentially be damaged. And I would love to know if any of these severe flu cases in younger kids or even deaths, I would love to know, have they had COVID? I think that would be a good case study to see, could that be why maybe they're having a rougher go of it with flu? And second of all, we have to ask, are they vaccinated for the flu? Either way, flu is behaving pretty bad this year. So moving on now. Minnesota on track to end flu season with highest hospitalization count in over a decade. Yeah, this is not good whatsoever. Minnesota Department of Health records show the state is on track to end this flu season. Flu season's not over, folks. Disregard that end of flu season because flu season, though we may be starting to drop now or very soon, flu will still be a thing for several more months. And of course, if bird flu turns into a bigger deal, well, then that's another road we'll have to travel down the line. But yeah, they're saying worst in a decade. According to MDH Weekly Influenza Statistics, the 2024 to 2025 season picked up around the end of October with 8 flu-related hospitalizations at the time. Since then, every week brought additional hospitalizations, sometimes multiplying week over week. By the end of December, they had 536 Minnesotans has been hospitalized. Get this, it has gone up way more. A month and a half later, the latest weekly report from February 8 listed 5,641 related flu hospitalizations in Minnesota. That's more than double the number of people, 2,599, who had been hospitalized by mid-February 2024. And like I said, we still got the rest of this month, March, maybe even parts of April as well. Sometimes flu can go on that long if you look at historic CDC data. So, yeah, flu not going well. And look at this. Houston, Texas. High severity flu this season. Hitting Houston this year brings illness and hospitalizations. Yeah, the numbers, they're not going well there either. While most people will recover, thousands have already died during the 2024-2025 flu season. Federal and state data released on Friday's show in our corner of Texas, this is in the Houston area, more than 900 people have died so far from pneumonia and flu-related causes in the 16-county region that includes Harris, Montgomery, Fort Bend. You get the point. This is the Houston metro area. That's really bad. And a child is, yet again, another pediatric death of flu. All right, moving on. What do we have next? Bird test positive for avian flu in Effingham County. This is, I believe, in Illinois. In this case, a hawk was collected in Effingham County and submitted for testing at the University of Illinois Veterinary Diagnostic Testing Lab on February 14th. The health department was informed that the bird had tested positive for avian influenza. So yeah, it's something that's really bad. And here we go again. Speaking of Illinois, we got another thing from there. Flu deaths may surpass COVID deaths in Illinois. Now, I want to express caution with this story. While that may be the case as of right now, if a summer wave or a spring wave of COVID should occur, like we have seen many times again over the past several years, like we have seen happen, that could alter that, and COVID could end up going back into the lead once again. But as of right now, they are saying flu deaths may surpass COVID deaths in Illinois. So, yeah, that's showing you how bad flu is this year. Speaking of things being bad, Pope Francis, prayers. We need to send prayers out to him. I mean, maybe not everyone here is religious. That's fine. But if you are, please send prayers out towards the Pope. The Pope is going to remain in the hospital, which is not a good thing. It's looking like he is having a complex infection in his respiratory system and will require more targeted drug treatment. He is 88 years old. We've reported about him several times over the last couple of years or since the start of this channel. So, yeah, he's going to have to stay in the hospital a little bit longer. Hopefully he gets better soon. God bless the Pope. All right, Mike Horger released his update this week, and I thought it would be interesting to share because COVID's not really doing what COVID usually does at this time of year. And you and I both know, for those of you who have been watching the channel for a long time, know that around this time of year, COVID's usually supposed to be dropping. And it kind of is right now, but it's not going straight down like it normally would. You know, it would peak after New Year's, and then down we would go. That's not really the case this year. And right now we're actually in a mid-sized wave. He is saying this is a mid-sized wave, meaning substantial transmission. Notice that transmission remains steady at high rates. Yeah, take a look here. Take a look at this red line. Yeah, it went down and then it just went, went up, down, and then straight across. And estimated data shows it may continue to do that. Expect steady or slightly, not rapidly, but slightly declining transmission unless the real-time data retroactively becomes corrected. We have seen CDC data and other data sources get corrected. And here's the forecast. You can see here. It's going to hold steady and then maybe decline slightly as we head into March, which means we're still going to have quite a few infections that will continue. Take a look at this. Right now, we're at 668,000 daily infections, according to him. Other sources may say otherwise. 1 in 72 are actively infectious. Sustained high transmission. 30 states in high or very high transmission at this time. And take a look at the CDC map here. You can see here, very high does exist in some places. Minimal or low does exist in some places. Believe it or not, it's been minimal in much of New York State, but there's been a few wastewater sites that have been high. Maybe that's what's been allowing for it to take so long for New York to start to drop. I don't know. We'll see what New York does this week. New York did not update today because it is a holiday. Alrighty, moving on now. Just a reminder, my website is datareport.info. You can find a lot of information. COVID studies, COVID outbreaks. You want to go back and find if a place had an outbreak. There's quite a few of them there. Not complete. It only goes back to 2022. And a COVID positive archive. That has grown a little bit. I might work on that this evening. I got to be in the mood to do that for some reason. Because sometimes it can be depressing. Saying, oh, this person had COVID, that person had COVID. Or I'm just not in the mood to do it. But I did add, I found out that in 2022, while on vacation in Ireland, Bill Murray picked up COVID when he was there. And why did I find that? Well, last night was SNL 50, which Saturday Night Live's 50 years, and turns out I wondered. I was looking, and I said, boy, he looks like he really aged since the last time I seen him. Sure enough, he did have COVID, but overall, I mean, he is starting to get up in age. All right, moving on now. Canada, viral activity level. We need to refresh this. Hopefully there's an update. And it looks like COVID-19 moderate, flu A is high, flu B is moderate, and RSV is high at this time. Taking a look at Pinellas County, Florida, I do see several sick person calls and a bunch of other things going on. Taking a look at what's going on with air qualities, and we can see air qualities, you're going to be surprised. Actually, the best this map has looked in a while. A little bit of a problem in the plains. Not bad in the east. Not bad in the Four Corners region of the Rockies. And the West Coast still does have some minor problems. Taking a look at Philadelphia. Philadelphia has 795 EMS incidents reported for Sunday. And I don't know, did we get an update on Philadelphia flu data? I don't think we did. Let's see, I'm going to click on this. And looks to me like this may be the same data from yesterday. Now, today's a holiday, and this is through February 1st. Hopefully we'll get an update on this tomorrow. Pennsylvania itself does usually update on Tuesdays. Whether it comes in on time because of the holiday, that remains to be seen. Take a look at Montgomery County, Pennsylvania. 16 active calls right now. We see respiratory emergency, cardiac emergency. So yes, there are some things going on there right now. And I'm still seeing a scroll bar. Okay, it's gone, but yeah, it looks pretty busy in Chester County, Pennsylvania. I'm seeing sick person again, respiratory difficulty, another sick person, heart problems, seizures, falls, all kinds of things going on. It's a busy day for EMS there, and the hospital situation in Pennsylvania. Let's see here. To my surprise, take a look at the Pocono Mountains in northeast Pennsylvania. It was a major ski weekend. Not bad. Green there. But we are seeing some yellow in Lehigh Valley hospitals. And yes, some hospitals in southeast Pennsylvania. And just one in south central PA, Gettysburg. I believe that's WellSpan Gettysburg. Emergency department is reporting that it's overcrowding at this time. Let's take a look at what's going on in New Jersey. And oh my, we do see patient volumes starting to add up there. We do see 1, 2, 3, 4, 5 hospitals. And it looks like it says patient volumes at all of them. And the other hospitals, no. So 5 hospitals in New Jersey with patient volumes at this time. Not a good thing. And some of these are on divert at this time. Divert not being a good thing. All right, taking a look at what's going on now with Walgreens. And we're just going to quickly go through some of these states because I do want to do some more wastewater. National positivity rate at Walgreens is 10.9%. Unfortunately, that went up. But there's a reason why. It's up by 0.8% from 10.2%. And it went up because the total number of testing came down. This is actually a big drop. 8,636 tests versus 11,274. I know, we're talking about tiny testing amounts compared to a few years ago, but that's enough to cause all this red you see on the map. What is red, might you ask? Red means rising positivity rate. Could be because of cases, could be because of the fact that testing did go down, and in a majority of these states, testing did drop. Green means positivity rates dropping. And, sometimes testing rates can drop and it can still be green. Well, that would mean your cases are likely going down. Like, for example, take a look at Louisiana. The positivity rate there is dropping, and that is with a drop in testing. Very good to report because there was just a Super Bowl there not too long ago. 14.5% positivity rate. That's down by 8.2%. But your neighbors are not doing all that great. Mississippi, 14.6%. That's up by 0.8%. All right, for granted, you did see a drop in testing, 48 tests versus 94. But check this out. Alabama, 26.7% positivity rate. The prior week was 13%. That's up by 13.7%. Testing, 101 versus 154. Yeah, that dropped, but I want to say some of that could be cases as well because that's a pretty big positivity rate increase. Tennessee, up by 4.1%. Your positivity rate is 12.5%. Just going to quickly go through these now. 11.9% in Arkansas, that is up. Testing is down. Oklahoma, testing's down. Positivity rate is up. 7.7%. California, positivity rate has dropped. 8.9%, that is down by 1.1%. Pennsylvania, positivity rate is up. It is 10.1%. That's up by 4.5%. 119 total tests versus 125. Minnesota, 10.1% positivity rate. That is up. Iowa is up 12.9%. Again, the majority of these are because testing has dropped. Michigan, 16.7%. And that is up slightly, 228 tests versus 241. So again, the majority of these are because testing is dropping. And at the same time, the COVID rates are just not rapidly dropping either. So that's what's leading to this. We'll take a look at some more of these Walgreens places tomorrow. All right, I do want to show you some wastewater data. First off, I don't think we showed this map yesterday. Taking a look at this from the CDC, we do see that there's that island of blue in New York State. New York City, though, is seeing some red. Looks like some of the New York City wastewater sites are reporting once again. I've not been able to say that in a while. Anything that's in blue, low COVID. Orange, moderate, and, well, red is high. So orange and red we don't like to see. We are seeing orange and red out in the Four Corners region in places like Arizona. There's still some orange in New Mexico. However, it does look to be better there now. Take a look at this. Santa Fe, actually, you had a big drop. Now you're slightly going up again. What's that all about? Okay, the other sites are dropping at this time. In Oregon, we can see Oregon's COVID levels. Mind you, this map is for COVID. I should have said that. We can see in Oregon, there are some rising levels. Marion, Oregon. What's going on down closer to California? Jackson, Oregon. I don't know how recent this is updated. Looks like maybe February 10th. Not good to see things going up there. Washington, while we're at it, too. And we can see, Washington's going up somewhat at some of these wastewater sites. There's another one. Thruston. That's going upward. So not good to see that. And the Midwest, which got hit hardest this winter, is still seeing a lot of orange and red sites at this time. All right, let's go over to a different dashboard now. We want to go over to the CDC dashboard. We want to take a look at Oregon and Colorado on this. First off, here's COVID. COVID's very high in Oregon at this time. We can see here that there's a lot of wastewater sites that are very high. It's overall categories at high, though, but you can see there are, where the population centers are, there are some very high sites still showing up. And now taking a look at Colorado, and we can see in Colorado, it is moderate at this time. Let's also go to, how about Utah? Do we have Utah on here? Oh, yes, Utah's listed at low, but mixed in between. You do see there are some very high wastewater sites. So, the less populated regions, I guess, are low. Maybe that's why. I don't know. There's some moderate, high, very high. quite a few sites there. Huh. Odd that that is coming up low. All right, let's go over to influenza A real quickly. And influenza A, as we know everywhere, is very high at this time. Nationally, on the national level, it is still very high. There's just a couple states that are not. Taking a look at Oregon, apologies for the wind in the background. It is extremely windy. I don't know if you can hear that or not, but the wind has just been howling since about 6 o'clock yesterday. Oregon is very high for flu at this time. Please use extra caution for that. In Colorado, it's moderate at this time. That's glad it's not high, but it's moderate at this time. And in Utah, you can see just only 2 wastewater sites reporting for flu, and well, very high does rule the roost. There's one that's high, the other one's very high. Very high wins out over high. Taking a look at overall respiratory illness activity in the United States, and it remains high at this time. Taking a look at the CDC influenza-like illness map, and you can see here that we can go back to other years. And here we are right now on February 8th, 2025. Let's go back real quickly to around this time last year. Can we do that? Can we actually look at that? February 8th of 2024, or on or around there. Yeah, take a look at last year at this time. It didn't look anywhere near as bad as it is right now. So here's February 10th of 2024. And now here we go to 2025. Take a look at that. It is a heck of a lot worse this year than it was last year at this time. Not a good trend whatsoever. Taking a look at this, we're going to do Oregon. I do have it set up here. Hospital capacity in Oregon at this time. We can see that it is 78% of hospital capacity being used. And let's just randomly go to some other states now. Pennsylvania hospital capacity, 80.3%. And I do wonder, what's the hospital capacity like in Rhode Island? Because as we know, if you've been a long-time follower here, Rhode Island constantly has problems with hospital capacity. 83.2%. Wow, that's actually good. I mean, you can see how many times they're higher than that. Sometimes over 90%. Wow, that's actually really good. Let's go down to Texas. I want to know what's going on there. They're getting hit so hard with flu. 77.7%. How about we go down to Tennessee? And in Tennessee, 78%. If there's time tomorrow, maybe we'll do some more of these. I don't think there will be because we get a lot of stuff on Tuesdays sometimes. Pennsylvania, maybe some other things. XEC variant of COVID is at 37%. LP 8.1 is at 31%. And I think I had one more thing for you today. Let's see here. Yes, overall positivity rate for influenza on the most recent update is 31.6%. And for influenza A, H1N1 and H3N2 were the predominant viruses reported in the most recent update from the CDC. Alrighty, folks, that does it for the Monday virus update. We will have another virus update again tomorrow afternoon. If you enjoyed us, give it a thumbs up, subscribe down below, hit that notification bell, share this video with anyone you know, and of course leave any and all comments down below. I will see you all again next time. Until I see you again next time, have a fantastic Monday afternoon, and thanks for watching.